gentle rhythm beyond compare. Raindrops tap the tender beat as jasmine.
Thank you all for joining us again. We are getting ready to discuss part two of our mini series, which is education and treatment before and after delivery. So, Sion, welcome back to part two of this discussion. We are going to talk about how we should take care of ourselves before and after delivery. But this is going to be a little different because we're going to talk about how to focus on self care for mother and the baby. So, my first question for you, from your perspective, why is self care important in regard to prematurity awareness?
Yeah, thank you again. First series is that it's holistic health and wellness. And so self-care is the cornerstone of that. Before pregnancy, the key is how to ensure an individual, a woman in our community has health. And what does health mean? And what does wellness mean? But understanding that, again, health behaviors where our goal is continue to reduce experiences of obesity. So how a woman can be active, again, whether it's just walking, we do little steps. Sometimes individuals get, overwhelmed if they feel that they have a long journey of towards wellness, but every step counts. So first thinking of physical wellness, just what we eat, how do we ensure that we have a healthy weight? In the healthcare system, we evaluate BMI, so body mass index. That is a calculation that looks at your height and your weight. If an individual, if they're interested on what their BMI is, if they use a scale, they can weigh themselves, and then in knowing their height, they can just ask Google, ask Siri, what's my BMI? And so we want women to be within I'm gonna use quotes, normal range, right? Again, the goal is not to be underweight, and it's not to be, again, significant risk factors of morbid obesity. So how do we work through that and understanding? So that in self-care activities, we highly recommend at least 150, about 30 minutes, maybe a day, whether it's just walking, whether it's staying at home, again, many streaming services has little simple movement. How do we move our bodies to promote that healthy weight? And what do we eat? Because majority of our weight is based on what we eat. It's not necessarily how much we work out. So if we can make small, incremental changes and to ensure that we're eating a colorful diet, with fresh fruits and vegetables. And again, we know the cost of food is going up. The cost, what we say in the grocery store, the outer perimeter, that section has, but knowing resources to use if a woman qualifies for WIC or food assistance, it's important because that's what those systems are there for, to provide supplemental income or supplemental resources to promote a healthy diet, because diet is the cornerstone of physical health. Then we talk about mental, emotional health. Stress is a common risk factor for prematurity. So how can women, again, ensure that they are taking time for themselves, how they respond to stress, what resources they utilize to cope with stress? Because being an adult is stressful. Being a young adolescent is stressful. So how do we use things to help us with that? Whether it is meditation, it's prayer, it's talking to a confidential person. So you don't always need to go to a psychiatrist, a psychologist, but understanding that we have hotlines. So we have, again, a national hotline for pregnant women, postpartum women as well, and how to utilize that to ensure, because again, how do we reach out when we're stressed? The other portion of it is, again, ensuring you have access to healthcare, insurance, health insurance. So here in the San Antonio area, many of these resources that I'll talk about is located on the San Antonio Community Resource Directory. That is abbreviated as sacrd.org. They have a list of just about every community resource that you need to access healthcare to ensure you have that. To include, again, preventing infection. So a common cause of prematurity or leading associated condition is infection. We are just entering into flu season and COVID has not gone away. Also women, not just respiratory infection, but vaginal infections, sexually transmitted infections are included in that. And although yeast and bacterial vaginosis is not always associated with sexually transmitted infections, but knowing that increases our risk too. With having access to healthcare, how do we plan the interval of our pregnancies? We know that a common risk is if our pregnancies are too close together. If they're less than 2 years from birth of our one child to the birth of our next child, if it's less than 2 years, it increases our risk. Just because a woman's body goes through so much change and it takes time to recover that. And so recovery and to ensure that the woman, she grows this really beautiful, big placenta, and that's what's feeding the baby. It's the healing of her uterus. And so, again, just to summarize a little bit of what we talked about, self-care is a cornerstone. We talked about how 90% of things that are risk factors have a preventability associated with it. So ensuring that we have emotional wellness. We're talking to individuals, we're making sure we're preventing infection. We have access to healthcare. Those are all the things that help with self-care, right? Also, and reducing stress that's associated with it. How do we ensure that our pregnancy intervals are not too close together? Because we know that when they're too close together, our babies can be born too soon. So ensuring those things that are occurring, and again, reaching out in the local San Antonio region, or again, with your local area, you can Google doula near me. A doula, again, a licensed credentialed doula is an exceptional resource. And many communities will have something similar to what we call here, an organization called Latch Support, where they have a doula that is assigned to a woman, regardless of income, through care up to a year after delivery. So that impacts, again, support. You have someone confidentially with your concerns, your care. And so, again, that's a great question, Shani, of ensuring self-care. You know, my granny used to say, I can't give something I don't have. So if I want to care for others, I got to care for myself. And mind, body is so important. And to include, and when those are threatened or injured, how do you reach out to the resources available and not to try to just navigate that by yourself? Because as we said in the first series, it takes a community. So women that are pregnant or that's going to be pregnant, you are not alone. And how do they use those resources to promote mind, body, spirit, financial wellness as well, and access to healthcare?
Oh, Sion, there's so much valuable information here. Thank you so much. So for those that are listening and they're saying, sis, I already had this baby. How can I focus on self-care now after delivery?
Yeah. So even, before you go home, the key is, do you have an understanding of the warning signs to report? And so we have national, state warning signs that every pregnant woman and family should have on their refrigerator. Those are significant because we know that some of these, we're talking about prematurity awareness, but it's also the health and the wellness between pregnancies and following pregnancy. Because just prematurity is just one aspect. And so again, you had your baby, congratulations, sis. Babies are beautiful. they're stressful. The sleep deprivation. I mean, my baby's 14 and my oldest is 22, but I still remember that sleep deprivation that's associated with it. So how to do that? How to, again, surround yourself with healthy snacks, because sometimes you're too tired to eat a full meal. But having healthy food snacks around you, almonds, again, it can be a little bit more expensive, but again, with access to WIC, the food banks are phenomenal. Again, they provide those healthy things that, again, with a village. So if you were like me and my husband, I was active duty military, so I wasn't fortunate to deliver any of my children close by family. So that meant I had to rely on my community around me, friends, so ensuring that you develop a healthy network around you. And don't forget about those postpartum doulas, because not only do you have access to a follow-up appointment, that's the key too, is based on the risk factors with pregnancy and post-delivery, ensuring that the follow-up visits, whether it's 3 to 5 days for a blood pressure check, it's going to be, again, a 5 to 6 week evaluation to make sure you're just healing okay. And also follow up with that, but ensure, again, to help with the pregnancy intervals and whichever method works for that family and that woman. The key is to understand and have clear communication with family, with spouse, with significant others, that this is what we're going to do for family planning, and to ensure, because we know if we've had our babies too close together, they can be born too soon following. But self-care, sis, it takes, again, that community, that village. Whether you're like me, a military family that delivered, on the small island of Guam, but how do I knew, like, okay, I'm gonna establish this relationship. So when I need some help, and even if that help means a small break, like I just need someone to watch my baby so I can take a shower and to sleep, and to ensure that we're watching out for signs and symptoms of postpartum mood disorder. Because we used to think that everybody would have depression symptoms that look the same. They have a concern, or they're feeling a little down. Oh, they're just tired. But again, with postpartum mood disorders, they're complex. Just like each woman is different, each symptom is different. So not only kind of coming back, knowing those warning signs to report to a healthcare provider, an OB provider is key. Knowing the, again, national hotline for our pregnant women and postpartum women when we're having, again, concerns regarding our mood. We're just down. They'll say, oh, you just got baby blues. But again, how do we support that? Ensuring that you're healthy, you're building those resources and that strength to recover, because having a baby, that's not an easy feat. A woman just grew a human. And with the physical, mental stress. And let's not talk about our first baby or like our third. Maybe the second one was okay just because we was a little trial by fire before. But
Right.
once you have, the children that are outnumbering the adults, it becomes a little difficult. So use those resources, know the warning signs to report, and don't be afraid to take care of yourself. Don't own that guilt, that mom's guilt of saying, you know what, I'm just gonna tough it out. I'm gonna stay up 24 hours because my baby needs me. Again, whether you're breastfeeding or, however you're feeding your baby, making sure you are feeding you too, feeding yourself with health and wellness too.
But sis, don't stay up 24 hours because that baby is asleep 24 hours. Oh, thank you so much for going over some of the things that we need to be reminded of when it comes to self-care. Just like our previous session, self-care is a community thing. And like Sion said, we should not be afraid to reach out to those that we know, to foster those relationships, and to also use resources. So Sion, thank you so much for this follow-up session. And thank you all for joining us. And we cannot wait for you all to join us for session 3, where we discuss in-depth resources when it comes to prematurity awareness.
In a world so vast where dreams collide, we walk together side by side. Different colors, different creeds, yet love is the thread that intercedes. Through valleys deep and mountains high, we find our strength in the shattered sky. Hope is the beacon in the night, guiding us to a future bright. Every step on this nature trail, we celebrate life's wondrous tale. The rustling leaves, the gentle